Hi, I'm Paul Conrad, physio from the West Hill Physio Clinic. Today's video is actually how to use these things, the foam rollers. Did a shorter video earlier on just touching on some of the benefits of using one, so I'll quickly run through those now. So there's two different types of foam roller on the market, just to recap. Got the Biofoam roller, you can pick these up from as little as £10, and then you have the multi-level rigid roller, which give you a much firmer type of massage, and it has little projections on here so you can kind of get into all the knots in the muscles, and probably more suited for those people maybe with a slightly higher pain threshold. The reason you might sort of go for this one over this one or vice versa is really depending on your budget, because there's a big difference in price. These will be about 10-15 quid. These ones, a lot more expensive, be about sort of anything at £80-90, depends on where you buy it from. So just quickly touch upon benefits. So increase in blood supply is the main benefit to it. So that can be a good thing if you've done some exercise and get the blood flow into the muscle after exercise to sort of flush out any impurities. That can sort of help reduce soreness perhaps the next day, or this delayed onset muscle soreness that some of you may have experienced after exercise. Can also increase flexibility in the muscle, and they feel that's due to some sort of stretch effect in the tissues as you're trying to sort of slide the muscles over one another. A lot of the research has shown that there's some benefit to or short-term improvement in hamstring flexibility after using the foam roller. So if we can make ourselves a little bit more flexible after doing exercise, flush through the impurities, it'll kind of reduce any injury risk, chance of pulled muscles and that kind of thing as well. The last only other thing really was that you can also use these things to stretch out before exercise as well. That's the other thing I touched on. There's some suggestion that if you do static stretching before you go and do sport, then it can compromise muscle power output. But the research has suggested that that doesn't seem to make a difference if you use a foam roller before or after exercise. So it doesn't affect muscle strength, so feel free to roll out either before or after your workout. It's kind of up to you from that point of view in terms of if you're worried about affecting muscle strength, but definitely do some afterwards. Alright, so these foam rollers, yeah, the more rigid one, so it's a little bit more uncomfortable, so I'm going to be a bit of a wuss and go for the less rigid one. Put that one out of the way for a moment, and really the best use of them I feel is kind of working on more of your lower body. So the main muscle groups we're going to kind of look at today. So I'm looking at this there, so we're going to do your calf, you can look at your hamstring, IT band, so this is down the outside here, so this is a really good thing for you runners out there, thigh, glutes, and also touch on how to sort of maybe loosen your back and sort of neck and shoulder area off a little bit and kind of just get a bit more mobility. Again, that can be quite a good thing for those who are stuck at an office desk all day. So without further ado, we'll crack on. So the first one is your calf, so I'll do it from this angle here. So basically we're going to pop the foam roller directly underneath the calf here, and we'll tend to sort of just prop yourself up like this, and you literally roll up and down on the calf area just like this. Okay, if you find that the pressure is okay, obviously the more pressure you can apply, then sometimes the greater sort of the release effect in the muscle. So you can also put the other leg on top of one that you're rolling. That increases the pressure. You can also at the same time pull your foot up like this. That puts a bit of a stretch on the muscle at the same time as well. As we're doing this, I tend to sort of roll over so you can hit the different fibres of the calf as we're going over it. In terms of how long you should do that for, I'll go for about a minute, or if you can't tolerate that, kind of as long as you can comfortably do it, up to sort of a minute at least. If you find any parts of the muscle are really quite sore as you roll over it, my suggestion is to find or locate that point. So say I got to here and that was a little bit uncomfortable. Actually it is on me, it's a little bit sore there. Keep the pressure on and hold that for anything up to a minute or so. And what should happen is the sort of soreness should sort of die away. And then as that dies away, then you can continue to roll out over it. So a little bit of pressure can actually sometimes induce what we call a neuromuscular reflex, and it can actually relax the muscle, so make it a bit more comfortable afterwards. Something to be mindful of course, if you're rolling across anything and it gets more sore, That shouldn't happen, but if it gets more sore, then don't do it, okay? Because it's probably your body's way of saying that maybe you've over-pulled a muscle, and you don't really want to be trying to stretch and release off any muscle that you've pulled. So that's how you do your calf. We'll move on to your next one, which is your hamstring. So nice and simple, not to move further up. We'll pop that just behind the knee here. So another good thing just to touch on is don't over put too much pressure on your joints. So if you're doing your calf, don't sort of roll right underneath the knee too much as well. So kind of just stop short of where the tendon attaches behind the knee here. Especially around the back of the knee, it's highly abundant with lots of structures. They've got a big artery, popliteal artery that runs through the back of the knee. Don't want to be too much pressure on that either. So coming up to your hamstring, so again just above the knee here, and it's kind of the same technique really. I'm going to come up, I'm going to roll right into it here, and come back off again. Again, you can do that double leg to be fine. Single leg is too much pressure. Hamstrings touching right up into the ischial tuberosity, so that kind of your sit bones, okay, just right underneath there. So if you can come right up into that, and roll on there, and alternate the angle as we go across, just so we can get the different fibres as we're doing so. Again, go for about a minute. So doing well so far, because none of those are too uncomfortable for me. Next one, this is the dreaded IT band. So those of you may be familiar with doing this, it's quite uncomfortable, this one, so we'll see how I'll get on. But this is the band that runs between the hip down into the outside of the knee here. And typically people do a lot of running and jumping and moving around. It can get quite tight on people, and it's quite a useful thing to kind of keep this relatively flexible. So we'll do that way. Okay, so this is how I do it. So position the roller, and you get your body weight just on top of the hip here. I take my leg and pivot myself so I'm nice and stable. And I get myself into this position just like that, okay? And just start off by just going nice and loose and slowly just across the IT band here. So just using my leg here to pivot myself on and back off. So coming right down towards the lower part of the knee, and then coming all the way up towards the hip. And again, if you get any sort of sore spots, then you can just sort of stop and pause on those. So again, got a bit of a soft sore spot there, so I'm going to hold that for a few seconds, or maybe 30 seconds or so, just until that pressure dies down a little bit. And then as it does so, then you can continue to roll again. And again, remember just to angle the fibres a little bit. So the IT band actually comes right behind your glute max here and searches into some of the deep fibres up here. So it's quite useful to also make sure that you're hitting those fibres as well, so coming right up into that attachment up the top there, all the way down. Okay, if you want to increase more pressure, then again get your body weight off it, and then we'll go up and down on it like that. Obviously repeat your opposite side. If you want more pressure on that, then you have to go to the rigid roller. I'm not going to do that because I'm too much of a wuss, but you guys go for it. Okay, so that's your IT band. Thigh, so maybe working in your quadriceps area. So similar idea of this one. Pop it on the floor, so I'm going to go into your front. So again, position yourself almost in sort of a press up position here. Again, try not to overarch your back, so you don't want to give yourself any back pain. And again, I'm going to get my body weight just onto it. I'm going to roll. That's just using your arms just to pivot onto. And again, this is a really nice one if you've done any sort of hip training, or you've done any running or any particular core work, quadricep work in the gym, squats, lunges, that kind of stuff, cycling. Get on there and give it a good old stretch afterwards. And you can see I'm just changing the angle of the pull there. You can also angle it slightly so you can actually get into more of the adductors on the inside there, if necessary. Okay. Right, next one, doing all right. Glutes next. Okay, so I'm just going to get onto the gluteal region here. So I tend to, I'm going to do my right one here. I'm going to sit on that and basically get myself to this figure 4 position, and I'm just going to roll across it over here. And it's quite good to work in. I don't know if some people know anatomy, there's another muscle called the piriformis, which can, some people get a little bit uncomfortable. It's quite useful just to sort of stretch across there. Some of the other external rotates of the hip. Okay. And then lastly, your back. So this is how I do with my back. So this is really good again for people who work an office desk quite a lot. It's really nice for just trying to get a little bit more mobility, get a bit more extension in the back. So if we sat down and we're in this kyphotic position like this all day, can get quite put a lot of stress on your lower back and your neck and shoulders. So it's quite nice to get a bit more extension into the spine, and this will do this quite nicely. So kind of put it into your mid-back area here. So rather than actually releasing your muscles, it's quite good for mobilising the joints in your upper back. And put your fingers on your temples. You can take a nice deep breath in through your nose. And then as you breathe out, you can just gently extend. And then you come back up again nice and slowly. Tend to do that just a couple of times on each level. Once you've done that, you can roll down a little bit further, do the next one. Again, breathe in through your nose. As you breathe out, just gently extend back. Again, I must stress here, just only go as far as you feel comfortable. So if you've never done this before, don't be too keen. Don't throw yourself back too much. You can end up injuring yourself, and you might get the injuries from there. Okay. Once I've done a few of those, tend to sort of stretch the muscles out a little bit. So what I do once I've got my body weight, my back weight into the foam roller, just lift your hips, and then you can actually start stretching right out up into the neck and shoulders, and then pushing over your feet so you can actually come onto your lower back. When you come onto your lower back, really important you don't arch your back. So you don't really want to be arching over the roller with your lower back, okay? Because you are quite easy to sort of pull a muscle in your back or overextend injury. So it's kind of okay to extend here, but try not to overextend too much over here. But as long as you keep that relatively up here, roll all the way up and all the way down through there. It's a really nice thing to do. So if you've been hunched over an office desk all day, this is one of my favourite ones. So after working, tend to try and do this sort of a couple of times a week myself. Just when I work with clients, just sort of really nice to get a nice extension in the spine, and that will keep everything moving. So as I said, predominantly foam rolling is really good for maybe lower body work, or I find it's more useful for lower body work. You can use it on other upper limb body parts, but it's a little bit more difficult to kind of get the purchase and the body weight through it. But you know, that kind of covers the basics of it. So yeah, definitely advantages to do it. Try and incorporate it into your exercise routine. Even those guys, you know, you don't exercise very much, you'll definitely get some benefit out of getting a little bit more flexibility in the muscles. Certainly for your upper back, as I showed you, it's a really good way of reducing postural stress on your back and neck. And you know, roll with it. It's a really good thing to do. So if you found that useful, do touch on our YouTube channel, Injury Fix for free. Do click the like and subscribe button, or share it even better. We can let you know when we post other videos, and also check us out on Facebook and Twitter. Thanks a lot for tuning in, and hopefully we'll see you in the next video.